Hello, I'm Dr. Sindhu, one of treating doctor here today. May I confirm your good name, please? Nice to meet you, Mr. Ruxana. May I know what brings you here today? Okay. Tell me more. I'm very sorry to hear about it, Mr. Ruxana. I understand your worries being parent, but I'm glad and I appreciate that you have made first step successfully by coming to see me to help your son. So, Mr. Ruxana, if Bilal is accompanying you. All right, Mrs. Ruxana, it would have been better if he could accompany you so that I could have examined him. But it's okay, Mr. Ruxana. I'll ask few questions regarding his condition. Okay. And thanks for your cooperation. So, Mr. Ruxana, what is the age of your son? Okay. May I know the percentile of his age and weight according to his age and weight? If you know it. Okay, 98. Okay, so do you think Bilal has a weight problem? Okay, and when did you first notice Bilal's weight problem? Okay, and what sort of food he likes to eat? Okay, does he eat food with high sugar and fat content? Eat food rich in salt? Okay, and does he often eat fresh fruits and vegetables? Okay, and where does he eat meals? With family or in his room? Okay, is he eating secretly as well? Okay, and how much exercise does he do? Any sports he likes to play with his siblings or friends? All right, and does family ever do activities together such as swimming or walk? Okay, and what is the whole family's lifestyle? What does your husband think about family's lifestyle? Okay, and what are other children's views? Okay, and how is Bilal getting on in school? Okay, does he have any educational or learning difficulties? How about his mood, Mrs. Roxana? Okay, has he mentioned any aches and pain, headache or visual disturbances, urinary frequency, disturbed bowel habits like constipation, diarrhea? Okay, Mrs. Roxana, have you noticed a change in his voice? Okay. Okay, Mr. Ruxana, if he is suffering from any medical problem like asthma, I'm sorry to hear about that. If he is taking any medication for it, steroids, okay, high blood pressure, high blood sugar, any neck-related problem, okay, if he is allergic to any medication. Okay, Ms. Ruxana, I'll ask few personal questions to better understand. So, what is your husband's job? And what do you do for living? Okay, and how many more kids you have? Okay, any problem with other kids? All right, and do you guys like to exercise? And what sort of food you guys like? Is there any financial barrier in adopting a healthy lifestyle? Okay, okay, Mr. Ruxana, if there is any family history of endocrine disorder, high blood pressure or high blood sugar, neck-related problem, for obesity running in your family? All right. Okay, Mrs. Ruxana, so the questions I've asked and the history you have shared, I came to the conclusion that most probably, as you said that his percentile is 98, I come to the conclusion that Bilal is suffering from obesity, okay, and besides that, as you stated that obesity is also running in your family, okay, so in your case, we need to think about the whole family needs, okay. Mr. Ruxana, well, somebody's intake is more than output over a long period of time, obesity results, okay? And management of obesity aims to reverse this trend on a long-term basis, okay, Mr. Ruxana, if it makes sense to you. So, Mr. Ruxana, have undergone any investigation so far? All right, Mr. Ruxana. So I'll order a few blood tests, okay, to be on safer side, okay. So here is fasting lipoproteins, okay, and fasting glucose, LFTs, and thyroid function test, okay. And now come to the management part, okay. So Mr. Ruxana, I'll encourage you to adopt healthy lifestyle, okay, for Bilal and whole family, okay, and try to have a healthy diet, okay. Use canola oil or olive oil 1 teaspoon per person for cooking, okay. And I'll encourage you to avoid oily, greasy, and fried foods, okay, and try to have 5 portions of fruits and vegetables every day, and try to take all sorts of pulses, beans, and legumes, okay, and try to have a low salt and low fat diet, okay. And avoid red meat. Poultry is okay, but I'll give preference to grilled, okay. And fish is good, okay. It contains omega-3 and 6 vitamins, which are good for heart, okay. Try to take fish twice a week, okay, and try to take 2 tablespoons of nuts daily. Have at least 8 glasses of water daily, okay, and decrease hidden sugar calories in food, okay, prepared foods, okay. And I'll encourage you to increase fiber in food, okay, Mr. Ruxana, if it makes sense to you. And besides that, Mr. Ruxana, I'll encourage you to set realistic targets and involve your children in deciding what changes you are going to make, okay. And also use rewards such as stickers or high fives, okay, when they reach their food and activity goals, okay. And help them get enough sleep, okay. And follow a regular bedtime routine, and remove digital screens such as mobile phones, tablets from bedroom at night, okay, Mrs. Ruxana, if it makes sense to you. And besides that, I'll encourage you for physical exercise, okay, for your children, and for a total of 60 minutes of moderate activity each day, okay. Encourage Bilal to take up sports when he enjoys, okay, and to limit time spent on watching TV or playing computer games each day, okay. Will you be able to enforce it? All right, Mrs. Ruxana. So Mr. Ruxana, also includes aerobic exercise, swimming, gardening until you think that he is sweating, okay, for a minimum of 30 minutes, okay. And give Bilal and his brother packed lunches rather than money, okay, which they can spend on unhealthy food, okay. Organize regular family activities such as going for swimming or walks with granddad. Ask are there any activities involving physical exertion that involve whole family, okay. And he can also eat the evening meal together at kitchen table instead at TV lounge, okay. How it sounds to you, Mr. Ruxana? Okay, yes, Mr. Ruxana, there are also group activities with Weight Watchers, okay, seem to have a higher success rate in producing and maintaining weight loss, okay. And behavior therapy are shown to be effective individually and in groups when combined with low-calorie diets, okay, in simplest forms, okay, Mrs. Ruxana. Okay, Ms. Ruxana, on a regular basis, essential to maintain motivation, okay. Is anything else you'd like to add? Yes, Ms. Ruxana, once as weight is lost, okay, and diet still needs to be monitored, okay. Ongoing follow-up has been shown, to help sustain weight loss, okay. And Miss Ruxana, weight fluctuation, yo-yo eating may be harmful. Okay, so you need to be cautious about that. Okay, in the end, Miss Ruxana, I'd like to talk to Bilal for a proper assessment. Okay, and so next appointment, please accompany him. Okay, and I'll take his baseline weight and height and rule out any pathology, okay, causing his weight gain. Okay, Mrs. Ruxana. And besides it, I'll refer Bilal to dietitian for further advice on meal planning. Okay, I can refer him to some help groups where obese people discuss their problems. Okay. Okay, Mrs. Ruxana, is everything clear till now? Should I repeat it again for you? Okay, Ms. Ruxana, is there anything else you would like to ask me today? All right, Ms. Ruxana, here is a leaflet. It includes all the information regarding obesity. Okay, I hope it will be helpful for you. Okay, and for you to make plan according to it for your son Bilal. Okay, and whole family members. And I wish a healthy life. Okay, take care of yourself and your son. Bye bye.